our first presenters. Today we've got Amy Corder and Laura Wright presenting on health literacy resources for librarians. Amy and Laura are both research support librarians at the Rudolph Mattis Library of Health Sciences at Tulane. Have I got that right? That's good, okay. And their presentation today, which I love the title of this presentation, it is WebMD Says I Have a Brain Tumor, Health Literacy Resources for Librarians. Amy and Laura, thank you so much for being with us today. Take it away.
Thank you for having us, everybody. Yeah, we came up with the title because it kind of exemplifies a situation with information overload and health literacy that I think a lot of us kind of identify with in some way or another. So just to reintroduce ourselves, we are Amy Corder and Laura Wright from Rudolph Mattis Library of the Health Sciences at Tulane University. We are going to turn off our cameras for this presentation to have bandwidth, but we did want you all to see our faces, at least for a second, to know what we look like and say hello. Our learning objectives for today are listed here. First, we're going to discuss health literacy, what it means, and how patients and professionals are affected. Then we're going to talk about how to find an article that's mentioned in the news that's health related. Next, we're going to discuss guidelines for reference interviews when it comes to health related information. And then we're going to discuss freely available and reliable resources that provide easy to read health information. These are also known as consumer health resources. Then we're all going to do a short exercise where we apply some of this information that we'll talk about to learn a little bit more about a health topic. And then later on, we'll open up floor for questions with everybody else. Today, we don't have time to discuss every single definition of health literacy that exists, but we would like to discuss an overview of the concept, as well as some of the ways that health literacy affects patients and healthcare professionals. The National Library of Medicine describes a little further than this definition, which says the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. The National Library of Medicine continues by describing it as a complex group of reading, listening, analytical, and decision-making skills, as well as the ability to apply these skills to health situations. So, for just a few examples, we have understanding the instructions printed on prescription drug labels, doctor's directions and consent forms, and just the ability to navigate through our very complex healthcare system. The definition kind of on the slide kind of leaves out one important aspect of health literacy, which also encompasses the ability of the healthcare provider to communicate clearly with patients. So on the patient side, this slide lists many of the complex tasks that we as patients have to face when navigating the healthcare system. In order to accomplish these tasks, we need to be able to interpret graphs, images, or other visual information, comfortable with using computers or the internet, able to access, evaluate, and apply relevant information, also known as information literacy, and also able to understand basic math or make basic calculations numerically. And another underrated aspect, especially in a multilingual country like the US, is oral language skills. Articulating health concerns and describing our symptoms is difficult enough in our native language, but for someone's second or third language, whichever language that may be be even more difficult, especially if you need to ask pertinent questions and understand treatment directions. So The National Library of Medicine talks about how low health literacy was once viewed as an individual patient's deficit. So, like a patient's lack of knowledge or skills regarding health issues. But now we recognize that health literacy is a systems issue because our health information and healthcare navigation systems are all extremely complex. Communication is one of the things that I think is the most obvious, such as medical jargon, language barriers, and just being friendly. It's not just an issue of the patient understanding what someone has to say, it's also an issue of effectively communicating. Even nonverbal cues that can make a patient feel like they need to hurry up, or a lack of awareness about which terms are medical jargon, can affect a patient's understanding. Regarding healthcare system navigation, the United States, as we all know, has a variety of types of health insurance, healthcare systems, and barriers to access at various points in our system that affect different demographic groups in different ways. The bureaucracy of a health insurance company or hospital can sometimes feel Kafka-esque when you're getting different tests done or calling to see if a physician is covered by your insurance. And then also another major thing is our busy schedules that we all have. Many employees in the United States don't have any sick leave, so that just affects whether or not they can call a physician to make an appointment or go to the doctor. And this affects our entire healthcare system. And here's kind of a fun statistic, I think. In 2003, the state of Louisiana became the first state to include legislation specific to improving health literacy, while other states followed later in the decade.
Okay, now it's on to Laura. So has anyone ever told you that they read a study, but they really had only read a news article that discussed a study and its results? Well, there's a way to find an actual study that is being discussed in that news article. We're going to find a study from a news article from NBC News. We're going to use PubMed.gov, and that's a freely available biomedical database from the National Library of Medicine. Okay, so once again, NBC News, we're going to look up this article, Common Joint Pain Treatment May Be More Harmful Than Thought. Our tips for this is just read the article, which we'll do briefly, and find any information that you can find about the study. Look for an author name, a journal name. If they happen to actually say the name of the article, that would be great. That doesn't seem to happen very often though. And then we're going to go to PubMed.gov and actually find that study to see what they actually say. Okay. So here we are on NBC News. So common joint pain treatment may be more harmful than thought. As we're reading through this article briefly, we're going to have a lot of ads in the way, but we're talking about corticosteroid injections that are often given to reduce pain and inflammation from osteoarthritis. The report found corticosteroid shots in the hips and knees. Okay, lead author, Dr. Ali Gormazi. Just going to copy this real fast. And he's a professor of radiology at Boston University. We can use that to make sure we're looking at the right study. Let's see. It's in the journal Radiology. Okay. We could read through to see if the title of the article is in this, and it actually is hidden in here as a quote from the author, but it's not actually listed explicitly here. So what we're going to do is we're going to come and search for PubMed.gov. I'm going to paste the author name, journal name, and I'm going to go and type corticosteroid injections. That was the main topic. Okay. So this article is about corticosteroid injection. So intra-articular corticosteroid injection of the hip and knee, perhaps not as safe as we thought. Here's Dr. Gormazi. Kind of check real fast. At Boston University, School of Medicine, Radiology. Okay. Now we have access to this through our university. That's why we have our little links over here. I do not think this is freely available. Usually PubMed will tell you if it is available, but you can see the actual abstract and read a little bit more about the study and what they did, what they found. As you go through down here, this is how they'll label any kind of free articles that are available through PubMed. So if you see that, you should have no problem accessing the article. But PubMed gives you tons of information. You have your study that you found, other studies that are similar. And this is my favorite part about this article, is that this has been cited by one article. It has the exact same beginning title, but then perhaps not as dangerous as they want you to believe. So always fun to watch scientists doing fun little petty things like that. Okay.
So this is Amy now. I'm going to take over and talk a little bit about the reference interview. There's a lot of great resources to help you think through a health-related reference interview. The one cited here is the Reference and User Services Association from the American Library Association. They have guidelines for health and medical reference that are specific for those who aren't medical librarians already. Also, the National Network of Library Medicine has a great ethics page that just talks about other ethical considerations. And we're going to share that with you on our handout that we're going to be giving you. So I just thought this was a great summary. This is not all of the guidelines out there, but it discusses, providing accurate responses, providing instruction in the use of these resources, much like any other reference interview, but also just always making sure that you tell someone, we are not healthcare professionals. We don't need to recommend that they see a specific doctor or have a specific treatment or anything like that. But we can, if they're trying to specifically ask us what they should do, generally the response is, perhaps think about making an appointment with a physician. I can't answer that because I have no training in being a doctor. And another important aspect that this doesn't mention, and we all know as librarians, is discretion. Because especially with health information, we have to be mindful of people's private health information, HIPAA laws, which are the laws that regard health privacy, and the fact that we are not medical professionals. We are information professionals. Also, we just can't assume that because someone is asking us about a particular health issue that they are dealing with the issue or that they know someone. They might just be looking up for a school assignment, or they may be genuinely curious. Just keeping this in mind while also being sensitive to their privacy and non-judgmental is important, just like in any other reference interview. So consumer health information. These are the types of resources that we will be showing you today. This is information on health and medical topics provided in response to requests from the general public, including patients and their families. In addition to information on the symptoms or diagnosis, there's also a lot of emphasis on health promotion and preventive medicine. These resources try to avoid medical jargon. Often they're written at a lower reading level, they're easy to read, and they're in multiple languages. And we are going to share with you later a link from the Medical Library Association called Find Good Health Information that kind of shares a lot of different links and talks about finding health information and the considerations you need to make.
Okay, and this is just a selection of the websites. It's definitely not exhaustive. I'm going to go ahead and show you, I think, 4 of these just for the sake of time. We're going to start with Medline Plus. I'm just going to open all of the links so we don't have to keep coming back and forth. I'm going to show you the CDC, familydoctor.org, and health information translations. Okay, we're going to start with Medline Plus. Now, this is a product of the National Library of Medicine, which is the division of the NIH. They're the same people that make PubMed and many of the other resources that we're going to look at today. This is a fairly easy to use website. The information is available in English, or you can switch the site over to Spanish. So that makes it a little bit easier to navigate if you need to look for information in a different language such as Spanish. Everything is already translated for you without having to go and actually search for that translation. You can find information on different health topics just by browsing drug information, different supplement information. There's videos and tools, so little tutorials and things like that. You can find information on medical tests. There's a medical encyclopedia. Materials are easy to read. You have different directories for organizations. And we can find information in different languages. By clicking this, it gives you a nice long list. I'm going to start off by just coming up and browsing some health topics. So this is broken down into a couple of different ways to browse. You can just search by a body location or a system. So if you're looking broadly at the immune system, you can do that. If you're looking for information on a disorder or just main conditions, cancers, which is a very, very broad category, but broken down into one little group. Demographic groups, health and wellness information. I am going to just go ahead and take a look at the immune system real fast. Well, let's just take a look at adult immunization. Okay. So we have some basic information, summaries, where to start, diagnostics and test information, research. Just kind of scroll through and see what information is available. You have different sheets that you can link out to. It tells you if they're available in Spanish or another language. Lots and lots of information just by clicking on immunization. And just for sake of time, I am going to come over here real fast to show you the health information in multiple languages. And this is a list of the different languages that there is information available on Medline Plus. It's not exhaustive. There's not going to be a link to every single page in Medline Plus for every single one of these languages, unfortunately. Some have more than others. I'm going to go ahead and select Vietnamese because that's something that we see a lot in Louisiana, especially in New Orleans. So this is what is available in Vietnamese through Medline Plus. Have all our A's, our B's. Let's see. Let's go with so many things. Let's just go with the progestin IUD user guideline. Go in Vietnamese. So this is a fact sheet that's available completely in Vietnamese. For someone who doesn't speak English or someone who just doesn't want to read this information in English, it's a lot easier to understand in your native language for sure. Okay, so that's an extremely quick run through of Medline Plus. There's tons of information available here, so I'd recommend taking a look at it after the presentation. Going to move to CDC, which is the Centers for Disease Control and Prevention. If you haven't heard of it before, I'm sure you have in the last probably 5-ish months. They've been in the news quite a bit. This is also a governmental resource. And this website has so much information. It's very, very, how should I say it? It's deceptive. You can do the same thing as we did with the last website, the Medline Plus. We're going to switch the site over to Spanish. So all of this information that you see on the front page in English is also available in Spanish. Additionally, there is information available in other languages. A lot of the information right here is about COVID. So let's filter by language. Let's do the same thing. Search in Vietnamese. Okay. So these are different fact sheets. One about manufacturing employees. So that's how you access information in different languages. The main page has just pertinent information to what's going on now, cloth face covering, social distancing information, when to wear gloves. I love this because there is an outbreak section, so you can kind of see about like any food safety issues are right there on the front of the screen. Let's see. You can search by diseases and conditions, just browse through and see what there's available. There's also healthy living topics. It's a great place for travelers' health. If we're ever able to travel again, it's a great place to come to find out if you need to go see a clinic, get vaccinations and things like that. There's a lot of emergency preparedness information. It's great for hurricanes, great for flooding, good for pandemic preparedness. And there's a ton more information. If you have someone that's coming to you for a school project or something like that, or just someone who's interested in different data and statistics, the CDC collects a lot and they make all of that freely available for you. You can download it, take a look at what's going on. Emergency preparedness information as well, injury, violence, and safety statistics, all of this. But let's just do a real fast one. Let's not do COVID. So this is the section on diabetes. You have your featured content and just basic information, how to prevent type 2 diabetes, living with diabetes, data and statistics. So all of the resources that you would probably want to take a look at on the CDC website can be found just by going to that condition page. Okay, moving on. So the last two resources I showed you were governmental resources, one from the National Library of Medicine, one from the CDC. This one is from an actual organization, it's the American Academy of Family Physicians. So if you have someone who really isn't interested in hearing what the government has to say about health, this could be a good resource to come and take a look at. Just like the other two websites, so it's broken out into different sections. We have diseases and conditions. Let's see. You can browse. Prevention and wellness information. Family health information is the American Academy of Family Physicians. And then there's your health resource. So you have information here for healthcare management about insurance and bills, self-care, working with your doctors, understanding doctors' notes, things like that. Information about prescription medications, BMI calculators, symptom checkers, dictionaries, things like that. Let's just go into disease and conditions since I'm already here. Let's go with acne. Okay, so it has a nice, easy description of what acne is, what causes it, how you can prevent it, different treatments, living with acne, as many of us must. There's so many things in all of these different websites that there's no way to be exhaustive. But you can go to Nutrition Shortfall Questionnaire. You can find out how to stop steroid medication safely, all of this different kind of stuff. And once again, this is a website that's not from the government, so it might be a good place to come and check. Similar to the last two sites, we can just switch over to Spanish and have all of our content available again. And the last website I'm going to show you from that first page is going to be Health Information Translations. Now, sometimes when you're on Medline Plus, you're going to find the information from Health Information Translations underneath some of the translated articles. This comes from a big group of people in Ohio that work to put together all of these different translations in different languages. You can search either by a health topic, or you can search by language. Let's go ahead and do this. Vietnamese. And these are all the topics that have health translations in Vietnamese. Let's go with low blood sugar. Okay. Now what's kind of neat about all of these is that they have a part of it in English and a part of it in Vietnamese. So it's like a dual language kind of thing. Let's see. There's many topics. Not every topic and not every language has as many topics. Let me take a look at Bosnian real fast. So there aren't nearly as many in Bosnian, but there's still a pretty decent amount here. See, coping with stress. Okay, it's available. Okay, and those are those sites real fast. We did just get a question in the chat asking if we have come across anybody who's been, I think, disputing pretty much the veracity of or the accuracy of information. I'll speak for myself as I'm going to the next slide, but we mainly work with healthcare professionals, and most of them, for the most part, haven't. There's definitely those people that think some of the stuff isn't quite right, which makes sense. I mainly have been following one pulmonologist and what he's been saying because I trust him. But we can talk about that at the end of the session too, just because it is a very interesting topic. So let's see. What I'm going to do now is show you two sources for drug information. What's great is that these two are actually interconnected. Pillbox is part of DailyMed, but it's its own separate little thing. I'm going to start with DailyMed. Also show Pillbox. Let me actually start with Pillbox, and then we can take a look at DailyMed as well. What I like about this is that it's a way for you to identify or search for a pill. I don't know about you, but I often find loose pills, and I'm sure many people have had loose pills brought to them and be like, do you know what this is? This is a way to find out. You have different characteristics that you can select to kind of identify what kind of pill you're looking at. If you have a name or an ingredient, you can do that. If you have any kind of imprint information, so the letters or numbers that are on either side of the pill, you can enter these right here. You have information about the shape of the pill. Let's see, I feel like most of the ones I ever see are circles. Maybe that's not a shape. Okay, we're gonna let it go, it's not a circle. You can do different colors. I didn't realize that there were pills that were turquoise until recently. And if you have any information about inactive ingredients, you can label that. I'm just going to search for any pills that are turquoise because that's cool. And these are all the different pills. If you have one right in front of you, you can take a look and just match it. And what I thought was interesting is the dexamethasone, which has been in the news a bit lately. It's the steroid that they were talking about that might help shut down the immune response to COVID for people that are having those cytokine storms. I'm going to go ahead and take a look. It's turquoise. And we're going to go take a look at the drug label in DailyMed. So DailyMed is the FDA's resource for label information, so the package inserts that you get whenever you get a medication. That's what we're looking at here. I lost my dexamethasone. I'm going to do it again.
Hey, Laura, just letting you know we're at 30 minutes right now.
Oh, no. Okay. Well, what you can do is you can find out all the information about dexamethasone that would be available in, we're going to look at the injection solution one, even though we were looking at the pill to start with. But you can find out contraindication information, dosage, all of that kind of stuff. Real fast. We're going to run back. And I'm not going to show you all the next resources, unfortunately, but these are two really great other health information resources. Toxtown, it's an interactive guide to commonly encountered toxic chemicals, your health and the environment. So if you want to find out about any kind of environmental exposures, it's a really easy resource to use. And the Genetics Home Reference is a really friendly, user-friendly information source about human genetics and genetic disorders. And it links into a whole bunch of scientific information from PubMed, once again from the National Library of Medicine. So you can take a look and find out more about genes, how they affect health, just really easy to use resources. Okay.
Okay, so can we take about 3 minutes to go into the breakout rooms as soon as I describe our activity? Is that possible?
I think that should be fine. Yeah, we can go
Okay.
in a couple minutes.
I promise it's nothing too dreadful. We just wanted to get everybody kind of talking and maybe get like a little bit of feedback in the chat. But we are going to share the, so basically here, this is kind of the guidelines of the activity. We have a folder with with some handouts and links to a lot of these resources, but we'd like you to select one of the following conditions. If you want to choose something else, if your group wants to choose something else, that's totally fine. Basically, we just wanted you to look up information using one of the resources that we shared with you today to answer a health-related question. And then after about 3 minutes, we're just going to come back and ask a couple of simple questions about your search for that information, whether or not you found information, where you looked, and if anybody had anything that they particularly liked about a resource. So if we could do about 4 or 5 breakout rooms, just to where people can talk about the resources a little bit, that would be awesome.
Hopefully you should be seeing an invitation to join a breakout room now.
Okay, I'm not sure what happened with the breakout rooms or if that worked, but if anybody wants to share any information they found that or a resource that they found particularly interesting, you can share in the chat.
There are still some people in breakout rooms now. I've sent a message that they're going to be closing in about 30 seconds. So
Okay,
there may be
great.
still some people rejoining.
Okay, awesome. Well, if anybody used any of the resources that we showed to find anything that or just look through them and found anything interesting or had anything to share, you can share it in the chat. If not, that's also fine. Okay, so I think everyone is back from the breakout rooms. If anybody had any thoughts that they wanted to share in the chat about a resource that they used or about something interesting you found in a resource or something new you learned, we'd be happy to hear back from you if you thought one resource was particularly helpful. I realized I did not successfully send the folder with all of the things, so it did require you remembering what we showed you, which I apologize, but hopefully you are able to find some useful health information. I guess I'll move on to the next slide since we need to wrap up. So this last slide, I'm not going to click into the website here, but this is just about critical appraisal, and the National Library of Medicine had a link to this Trust It or Trash It health information evaluation tool, which I thought was really interesting. It just asks the question, who said it, when did they say it, and how did they know? And if you click on the trustortrash.org website, if you click through each of those questions, it kind of guides you through the process, the thought process that you should think through when when appraising a critical appraising health information critically. Someone did share in the chat that they use Medline Plus a lot as a government documents librarian. And yes, and Medline Plus is extensively reviewed, updated all the time. There's also even links out to PubMed for some things, or just other government websites. So it is a great resource. And thank you, everybody. We will stick around to answer questions. Sorry, we're a little bit behind. So we just wanted to share some freely available, reliable resources of health information with you.
All right, Amy and Laura, thank you so much. I definitely know that there are a couple topics that I have that I would like to look on some of those sites for. So there's a few of those I'd never heard of in there. So thank you so much for that presentation. Remember, everyone, they did drop a link into the chat to the slides that they're looking at. So if there are some sites that you wanted to check out for later, feel free to go ahead and cut and paste that, or maybe bookmark that link. Again, we're going to save our questions until Q&A time at the end. And next, without further ado, we have Sonnet Ireland presenting on how to deal with conflicting information sources. Sonnet is the branch manager at the South Slidell branch of the St. Tammany Parish Public Library System, and she'll be giving us a talk entitled, Who You Gonna Believe When Governments Collide on Information? It's a pretty timely topic, I think everyone can agree. Sonnet, thank you so much for coming here today to talk to us. Are you ready?
I'm ready. Thank you for having me.
All right, take it away.
Okay, so can everybody see my screen? Working every other day has been very strange, so I came back to the work space to find that my stuff had been moved, and I was, So if you're having problems seeing anything, just let me know. Okay, so we're going to talk about government information. I'm a bit of a government information junkie, so of course that's what I'm going to be focused on when it comes to anything, really. So we're going to explore when government information has been at odds, and we're going to discuss ways to ensure that we get access to our people to the best information available, whether they're students, patrons, the public, faculty, whatever. My slides are a little wordy, and that is so if you miss the show, or if you want to look back on stuff, you can look and you'll have an idea of what we talked about. Now, there are numerous reasons why government information can conflict. First one, information evolves. So you may find changes in government information over time. That's perfectly normal, that's healthy, that's good. But you also may find that information from one government entity to another is different because of priority differences, and we'll go into that a little bit. The big one, the awkward one, is changes in administration or a change in agency leadership. And we're seeing a lot of that now, so we are going to talk about that. But some of that is not abnormal, and some of it is new in terms of what we're seeing now. So first, let's talk about what government information is, because when I say government information, a lot of times people assume federal information. They think US government information. They completely forget about their municipal documents, you know, from your city or town. Your state has documents, your county, your parish. You know, if you're in another state, it's a county. If you're here, it's a parish. And then, of course, you have international governments, you know, Canada, the UK. But we also have international cooperations, so such as the African Union, the European Union, and the United Nations. And those are just a few. I mean, you also have IMF, the International Monetary Fund, I believe, all these other organizations that are governments working together. It gets kind of tricky at that point because some people will say, well, that's not really government information in terms of such as the United Nations and the World Health Organization, but it is governments working together. So it's kind of it's more fuzzy than what we're used to in the United States. Now, I do want to say not all governments are as open about government information as we are. Not saying we're perfect. We've had our issues with the US government, you know, kind of not wanting to share information, putting up roadblocks. And this is not necessarily about the current administration. This has been going on for at least decades, probably centuries. But not all government information is easily available. There were actually issues with the Canadian government a few years back where they were not letting people have access to certain things. And while US government information is in the public domain, that's not the case for all governments, and that includes state governments. In most cases, for instance, Arizona has one where it's not technically in the public domain. You need permission to use it, but that's usually just for commercial use. You'll find a lot of county and parishes and city governments are very particular about their government information and who can use it. Don't know why, don't totally understand it. I just know there's a case about California counties having an issue. If you do a search for it, you'll find a lot of interesting stuff. So how can government information find conflict? Well, it could be agency versus agency. You could have, for instance, the EPA disagree with the Department of Energy over something, or you could have the school board of a parish disagree with the parish health board, any number of different mixtures there. You can also have a county or a city or a parish that disagrees with the state. And we're kind of seeing that, not exactly with government information, but we are seeing a little bit more division between the state entity and more local governments, where you have, especially in Louisiana, you're seeing a few parish presidents who are not too happy with the governor. You're seeing governors conflicting with the president, so that would be state versus federal. So you're having a lot of interesting mixtures that over time could lead to differences in government information. State versus state is not that uncommon. Usually you'll find similar information, for instance, from the Louisiana Health and Human Services to the Mississippi one, for instance, but that's not always the case. You can have a federal agency disagree with an international agency, or at least have some different focus on a certain topic. We're going to talk about that, or even the same entity over time. So we're going to talk about that with the FCC and the net neutrality issue. So we're going to start with the best case scenario. Information evolves over time. So what we're seeing now with the coronavirus is, I mean, it's something we've never faced before. Sure, you know, we can talk about the Spanish flu, but in terms of our level of technology, this is a whole new game. So I wanted to show that it's not necessarily that one is better than the other. Sometimes that's the case, but a lot of times you'll find that one entity actually has great information considering X, but the other entity is right about Y. And so I'm going to show you some of those examples. For instance, the CDC has been recommending wearing face coverings since April. The World Health Organization only started recommending that around June. I don't know why specifically. I don't have an answer that we can say definitively this is why, but part of me does wonder if it has to do more with other countries being more willing to quarantine than, you know, Western civilization if we want to call ourselves that. We're finding a lot of struggles with, mostly in the US, I think. I think UK has been okay, Canada's been pretty okay with the masks, but we have found a lot more struggle with quarantining and with face coverings in the US. And really, we were kind of towards the tail end of getting it. The WHO had already been working for a few months by the time it came to the US, in terms of it hitting China, Italy, France, Spain. So that could be a reason, but honestly, I just don't know. It could also be they're just hesitant to make these calls because they're getting so much information from so many sources. But you can see there's a couple of months difference between when they recommended, when one recommended and when the other recommended. On the flip side, we see the opposite in terms of reinfection. So immunity passport is the idea that you've got it and you can now be marked as having had it, so you're safe from getting it again, you're safe from passing it on to someone else. Well, the World Health Organization was quick to pass on details coming out of France and Italy months ago. I want to say it was early April, we started seeing those reports roll in that people who had gotten the virus were getting it again. Now, whether it was enough to warrant actually telling people, hey, you don't get immunity from this necessarily, not a scientist, not a doctor, but reading these reports that were coming into the World Health Organization from Italy and France, really made me more prepared when in June the CDC started researching, oh, hey, there's a possibility that you're getting reinfected. That being one of the unfortunate to get COVID does not mean that you're going to be immune in the future. So this was something that I found very interesting. And of course, the World Health Organization is going to be a little more on top of that because they are an entity of the United Nations. So they're getting information from over 100 countries, whereas we're focusing on the US. Now, that doesn't mean the CDC didn't know that was a possibility. It's just that their focus is on US. And there is still so much unknown about this virus. And the fact that there are different strains, you know, deadlier strains, and then there are strains that are more communicable. So it's been a very interesting time to watch, you know, the World Health Organization get this information, and then, you know, the CDC to pick it up as well. And then, of course, you know, sometimes they do hit around the same time. So they're talking about school-related public health measures, both from the CDC and the World Health Organization. The difference is the World Health Organization is taking into account multiple countries, and it's just basically offering their thoughts on it. You know, what people should consider, what people should look at, whereas the CDC has a little bit more authority in terms of the US government, and, you know, normally we look up to them and we look to them for guidance. That's kind of getting a little frayed right now, for lack of a better term, that tether to the CDC and their guidance is getting a little strained right now with disagreement between the current administration and CDC guidelines that will make it more difficult for schools to open in what we consider a safe manner. But it's interesting to see what they both recommend. For those of you who are not that familiar with the World Health Organization or even the CDC, the New York Times did a really good piece on them back in 2016. This was about the Zika virus. So this is not new. This isn't a situation where out of nowhere, oh, the WHO and the CDC, you know, don't necessarily always agree or may have different views. This is something that we see periodically. And a lot of times the CDC will have a different view because of how it affects the US versus how it's affecting Africa, Europe, Asia, you know, basically everyone else. There's a nice video on YouTube. I watched it. It really does break it down, and it will explain that the World Health Organization isn't technically government information, though they work for the United Nations, and I still consider them government. It's just, I guess technically we don't have to listen to them. So that's for when y'all want to watch that later, and all of this will be on my website probably by the end of the day. So why am I talking about the World Health Organization? Well, obviously COVID, but it is an agency of the United Nations. So instead of getting one country's perspective, you're getting information from various countries being fed into it. You know, it's 7,000 people, over 7,000 people, more than 150 countries working together to research things such as COVID, Zika, West Nile, AIDS, HIV, all of that. However, in a time like this, it's good to keep an eye out on other CDCs, the European Center for Disease Prevention and Control, which is a part of the European Union, Africa CDC, which again, Centers for Disease Control and Prevention. You can take a look at different countries, like the Public Health Agency of Canada. That can be kind of interesting to look at since they are our neighbors to the north. Chinese has a Center for Disease Control and Prevention. However, different government agencies and what we know about some of China's practices means we don't necessarily want to trust their information 100% because there is a benefit to keeping people in the dark in some ways. And that is not in any way an endorsement of the crazy conspiracy theories I've been hearing. That's not it at all. It's just China does have a history of not being the most forthright with information with their own citizens, let alone with foreign entities. So here's a happy little picture because we're going to get into some of the more disappointing aspects. So when you work from home and somebody wants to video chat, that's actually a live picture of me now, which is why I did not share my video. We're going to talk about change in leadership. So this was something that we were concerned about being in 2016 before the White House actually started. We were concerned about government data going missing. There's a lot of desire. Some of it may appear malicious. Some of it is just funding, to be honest. Some of it is people think we don't need to fund the census, and then suddenly all that data disappears. When the government shuts down, one of the first sites to shut down is the census site, like clockwork. You can expect that one to shut down. So people were trying to work together to save information, save data. It was a very big concern. And then as the administration took over, we did find that different web pages were disappearing. So we've had a lot of issues with the EPA and the removal of references to climate change. That had disappeared from the State Department as well. Another cost-saving measure, they've been trying to kill the Consumer Financial Protection Bureau for years. And that's not just the administration, but certain members of Congress have been trying to kill that, that particular entity for ages, and it actually does a lot of good. So Consumer Complaints Database, you know, cost-saving measures. Oh, what do people need this for? Let's cut it. Changes to LGBTQ related web content. So we've seen a lot of this over the years. And so here are some articles about, you know, activists rushing to save the data. There were librarians involved, archivists, scientists in different fields of science who were actually downloading data and trying to preserve what information we had on the off chance it disappeared. And this is more of a concern in recent years because, you know, very rarely will the government call you and ask you for a particular government document back, a physical document. It happens, but usually it's because someone's social security number is in it, you find out later. But to have virtual data, to have virtual information, and no print version means that if it disappears, it's gone. There's no calling UNO to see if they have it. There's no calling LSU. There's no one to give it to you unless someone's downloaded it and backed it up. So this has been a very big concern, especially with so much being online and being found through websites, which we all love. We absolutely love having that access, but not having a physical component does put it a little bit more at risk if you have a government agency or a government administration that does not want that information out, either because it doesn't look good or because they think it's a waste of money and it's a waste of resources, and couldn't we save money if we deleted a bunch of websites, and wouldn't that make running that site cheaper, et cetera, et cetera. So here are some actual scholarly works about disappearing government information, about the uses and abuses of government tools of information. And yes, the last three are focused on more recent issues, but I did include one from 2011 to show that this is not a new issue. It's new in some ways, but for the most part, you know, this has been a concern of government documents librarians for as long as there have been government documents librarians. This is not something that we're only seeing now. So looking at the more recent ones, it's getting a little more disconcerting, but disappearing government information is not new. What is new is disappearing data about COVID from the CDC. And these are the recent articles about that. And that is a concern. Originally, data was being reported to the Health and Human Services Agency as well as the CDC. Having it only reported to one instead of two does kind of make it a little easier to manipulate the data, and does make many of us very concerned about what that means for basically the future of government information and transparency issues. Yeah, and this does really underscore the framework. Information does have value. And so how do you handle this? You actually handle it the same way you handle almost anything else. A lot of librarians will freak out because of, you know, fake news, and they'll say, how do I deal with this? And I'm like, you can't manufacture an article that doesn't exist. If it's not a legitimate source, you just kind of have to go with that, and you have to say, well, you know, Pizzagate, the New York Times says it's just a rumor that people are spreading and there's no validation to it. Washington Post says the same. My favorite is pull out your favorite local reporter, Lee Zurich. When in doubt, hey, Lee Zurich isn't reporting on this, I'm going to say we're probably okay. So with the regular evaluation tools, you can choose any one you want. I went with CRAP because that's pretty much the most popular one that I've come across in terms of, you know, kids tend to like it. I'm all about making the children happy. But so this is what CRAP is: currency, relevance, authority, accuracy, purpose. And I have in there what your normal questions are. So first, we're going to look at an example, net neutrality. So net neutrality has changed. The FCC, which has been a big supporter of net neutrality in recent years, is suddenly anti-net neutrality a few years later. And for those who don't know, Federal Communications Commission is what FCC stands for. And so they control, you know, they ensure that communication systems are fair and not monopolies, and you don't want someone, it's why your phone can call 911 even if it's been disconnected for non-payment. So in 2015, you have, under the Obama administration, the FCC supports net neutrality with open internet order. And I actually include the archived government site explaining the importance of net neutrality. But what you're going to find is 2 years later, there was a change in leadership in both the White House, but also in the FCC. Now, the person who is currently the FCC chairman, let me see, his name is Ajit Pai, I think I'm saying it right. He was on the board or the commission when net neutrality became a thing. It's like a 5-person board. He was on it. He was against it then. But then he became the person in charge. And so that's what you see as he's explaining why he wants to scrap net neutrality. And if you read the FCC site about it, restoring internet freedom, it's talking about how net neutrality is bad because it hinders free commerce and it disincentivizes corporations from expanding internet access and from reaching into more rural areas, et cetera, et cetera. So here you have an agency going from one side to the other, and that can be very confusing. So how do you handle that? Well, I took a look at the FCC versus states. What are the states doing? I mean, I know my own personal feelings on it because I know about net neutrality, but if somebody didn't, let's see what's going on with the states. Well, not long after that happened, you have Washington is the first one to pass net neutrality protections. You have Massachusetts sued the FCC. You have California trying to protect net neutrality. So you see these states conflicting with the federal government, with this agency. So that gives you an idea of, okay, now granted, you know, Massachusetts is the most, I believe it's still the state with the most Democrats. California does have liberal leanings. So you could find someone who says, oh yeah, liberal propaganda. But I also like to check news sources. And to me, that's checking old and new ones. So looking at the Time article on 8 things you should know about net neutrality from 2014, it tells you different things about net neutrality, why it's important, what is it doing, what's the point. You also have the New York Times doing a piece on the repealing of the net neutrality rules and what that means and how that affects things, good or bad. And that's from 2017, of course. Now, sure, normally I would prioritize government information over news articles, but what these news articles do is they explain the issue. They let you know, what does this mean? If I repeal this, what does this mean? And with net neutrality, they even go into, it means that, you know, if your provider to make certain sites faster, other sites, or there's nothing to stop them on a federal level. So tweaking the evaluation tool is what really it comes down to. Looking at the dates of each source. Okay, so we see 2014 and 2017. What occurred between, or early 2015 and early 2017? What occurred between those 2 dates? We had a change in administration. We had a change in leadership at the FCC. So checking the relevance. Does the information focus on the topic? Does it address the disparity in the information presented? So looking at, for instance, an article by the CDC or a piece by the CDC saying, you know, we found after numerous studies that masks are suddenly better, makes sense. Whereas the net neutrality, why are they doing it? What do we know now that we didn't know then? And really it comes down to a difference of political views. Authority, look at who's leading the agency and what their credentials are. Now the agency, or the FCC specifically, has tended to be run by business people. And Mr. Pai is no different. But he has always been kind of hardcore laissez-faire when it comes to corporations. So you can kind of see why his leanings have always been a little different. Looking at what their sources are. And the big thing is look at it to see whether the information is from a research report or from a speech or a tweet, because there's a big difference. And if you look at the part with Mr. Pai talking, it was an interview by PBS, you have him talking about the importance of net neutrality being repealed, but you do not see necessarily too many people who are concerned about monopolies and whatnot agreeing with him. So that's always important to look at. It's very easy for the leader of an agency to say something in a speech and it would still be a government document or government information or even a tweet. The president's tweets from various agencies are all government information, but that has a different weight than an actual report on the importance of net neutrality that's been submitted to Congress. Accuracy, is the information supported by evidence? And does one source omit key information found in the other source? That's always good to look at, especially when you're comparing two different agencies. And of course, the purpose. Has the goal, either in words or in spirit, of the agency changed? Does this information coincide with a change in government? This is very important because many of our agencies have been given over to people who do not have histories with them. We're looking at that with the Department of Education, the EPA being run by somebody who's very big in the oil industry, the Consumer Financial Protection Bureau actually being run by someone who has talked about eliminating it hardcore for a long time. You know, these are different cues that, okay, you're going to have scientists still working in these areas, you're going to have people who know their stuff, but they're also under people that maybe don't share the historical goal or spirit of that agency. That was depressing. So I wanted to have another little funny thing because, quite frankly, this is all very depressing. Welcome to the life of a government documents librarian. It's just depression 24/7. But that's okay, because not everything is terrible. Always look for legitimate reasons. There are plenty of reasons, and this is the one thing I kind of skipped over, which is different goals, different priorities. There may be a legitimate reason when one source is lacking something that another source has. And what I found very interesting is the example of Zika or West Nile or any other mosquito-borne disease. Being from Louisiana, my thoughts were, you know, that's always in the front of our mind, like, ugh, mosquitoes, okay. And I started looking at other states and what their mosquito seasons were. And do you know Alaska's is like middle of June to end of July or end of June to middle of July? It's some ridiculous, less than a month. It's some ridiculous amount of time that sounds glorious, whereas ours along the Gulf Coast is anywhere from February to November, and that's a lie because in December it can be just as hot and you can have just as much rain and you can have puddles that attract mosquitoes. So basically we just live in mosquito season heaven for the mosquitoes, not for us. So of course, you know, if you're arguing with someone and they show you that, you know, oh, the Alaska Health and Human Services Agency doesn't think we should worry about Zika. Well, yeah, of course they don't. That's not a big priority. Getting eaten by a bear, probably a bigger priority. Alaska has a lot of crazy ways you can die. Zika is one of the ones they're not really worried about. But for someone like a Gulf Coast or Zika, West Nile, these are all very big concerns. So, you know, of course, we may have more information or we may prioritize that information. So keep that in mind. It's not always a sinister reason. And that is my presentation. And all of this, the site, my site will have the presentation up on it soon. Are there any questions? I didn't see any questions.
I am not seeing any questions yet either. I think, Sonnet, that has left a lot of us reeling.
I'm sorry.
No, don't apologize. I think the enormity of the issues that you bring up in terms of where information comes from, how it gets to us, how it's generated, how it's stored. These are some pretty darn heavy questions to ask for librarians, let alone to teach to other people in a library instruction environment. I know I'm going to be thinking about this stuff for quite a while.
And right now it's not that big of an issue. Like, we're starting to see it becoming a bigger issue with COVID, but it's one of those things that I have this unfortunate ability to kind of look at something and go, that's going to be an issue. That is going to be a problem. And I did it I think it was at a conference, I think it was at the LLA conference in 2017. I brought up, how are we going to store all these tweets? Because anytime the president tweets, it's government information and you can't delete that. You've got to store it. And someone from GPO was there and he just looked at me and he was like, oh God. And I was like, sorry, dude, I had this thought. And he's like, oh no.
And if we're lucky, there's some presidential speech scholar in a communications department who is, as a personal project, storing screenshots, or who knows.
Exactly. It's crazy. And Elizabeth is right. We do have a great dedicated group of librarians, especially in Louisiana, that are dedicated to government information. And I find that government information librarians, I didn't plan to become one. I fell into it. I feel like that's how most of us start. We become like the craziest, most rabid people you'll ever meet when it comes to government information.
I will say, like, this is like the sexiest GovDocs presentation I've ever seen.
I make GovDocs sexy. And thank you, Paula, absolutely. And yeah, I mean, the CDC is doing okay now, but now that they've been stripped of their data, I'm kind of like, are they just sitting there like, this is our thing, pandemics, this is like literally our thing. What are we doing?
I think a lot of people are asking that question, what are we doing?
Yeah.
Thank you so much, Sonnet. That was a really great presentation.
Thank you.
Do you have a link to that you could drop into the chat box?
Not yet. Let me see. I can, yeah. Okay, I guess I stopped sharing now.
That's all right.
Let's see. I can do one real quick.
If it turns out that you can't do it, we can always send out a link we're going to send out an email, a feedback email. So we can always do that as well. So don't feel pressure to perform here.
Right? Oh, no problem.
And I'm going to be sending out an email at the end of the week with all of the slides and links and everything that all of our presenters have shared with us. I'm going to be sending that out on Friday. And so any links you have here and that our presenters at the beginning of the presentation too, that Amy and Laura shared, that's all going to be in there too at the end of the week. So no reason to rush right now.
Awesome.
Yeah, and then in a couple seconds here, I think Elizabeth, one of our other board members, is going to be dropping a URL into the chat box. Paula, am I right that it's going to be a URL to an eval form?
Yeah, there should be. There's like a survey feedback form for today, and there's also the networking form too we have as well. If you didn't catch that at the beginning and you'd like to go ahead and get your information on there or see who else was here, or if you already saw it yesterday, you don't have to do the networking form. It's the same networking form from yesterday, but it is a different survey from yesterday, and we'd appreciate any information, any feedback you have for us today.
Yeah, and just as a reminder, we are recording all of these presentations, so I don't want to give you necessarily a time frame, but very soon we're going to be able to have them up on our own YouTube channel.
That'll be a couple of weeks because I want to make sure they're accessible, and so I need to caption them. So it's going to be a couple of weeks on that.
Okay. All right.
Awesome.
Cool.
I'm so glad they're going to be captioned. Thank you for that.
Yeah. No, I think I'm so glad that there's been a lot more awareness about ADA requirements, but also because sometimes I want to look at something and I don't want there to be sound on. So I like to be able to exploit that myself as well. Okay, well, unless I'm missing something, it looks like we are about done here. you know, if anyone thinks of questions afterwards, I think you can probably contact presenters. I don't know if I'm speaking for you guys, but I'm sure folks would love to continue conversations away from Zoom, such as they are. That's going to end our presentation for today. We've got another presentation starting tomorrow at 10 a.m. I do not have my schedule, but there should be, when everyone signed up, you should have gotten a little schedule as far as who's presenting on what, which days. I just want to say, take care, everyone. Thank you for coming, and stay healthy and be safe. So,
and I have that information real quick too, if you want it.
Okay.
It's Elizabeth Layton with Going Beyond the Call of Duty, Engaging Students as an Esports Coach, which I think sounds really exciting. That's really neat, a librarian as an esports coach. And then we have Alicia Schwarzenbach and Celine Holmes talking about It's a Graphic World, using graphic novels as informational text. And they were recently featured in an article in Booklist. I think it was Booklist. And so that's really exciting too. So we have two really good presentations tomorrow.
all right. Yeah, so far this has been a great set of presentations, and I'm looking forward to continuing them for another couple of days. All right, guys, I'm going to sign off for us today. Hopefully we'll see you tomorrow.